There is nothing like a good night's sleep to make you feel relaxed, refreshed, and ready to go. But for many people, getting truly restful sleep can seem like an impossible dream. Millions of people have a potentially serious condition called sleep apnea. People with this condition can't get restful sleep because they may awaken 50 or more times every hour. This can cause fatigue and depression and increase their risk of accidents, stroke, and heart disease. The most common type of sleep apnea is called obstructive sleep apnea, or OSA. In this condition, tissues in the back of the throat, such as the tongue, tonsils, or soft palate, collapse and block the flow of air through the windpipe. Temporarily unable to breathe, the restless sleeper wakes up briefly, gasps for air, and repeats the cycle again and again. More men than women have sleep apnea, and most people with OSA are overweight. Loud snoring and daytime sleepiness are common symptoms, but only a medical professional with experience in sleep disorders can diagnose and treat this condition. So what does this all have to do with dentistry? Your dentist can provide custom-made oral appliances, which can effectively treat sleep apnea in many people. These oral appliances are used to reposition your jaw and prevent soft tissues from blocking the airway. There are other treatments for sleep apnea. In fact, the most common is a machine with a face mask that supplies a constant flow of air under mild pressure to keep the airways open. It's very effective when used correctly, but it can be difficult to get used to. Some OSA patients have even compared it to sleeping in scuba gear. Surgery to unblock the airways can be another option. However, most doctors recommend trying a conservative approach before surgery is considered. In choosing among non-surgical approaches, many people find that an oral appliance is much easier to tolerate than a machine with a face mask. And after wearing an appliance for a while, people often say they feel dramatically better, almost as if they have a new lease on life. These appliances work really well for people with mild to moderate obstructive sleep apnea. If you think you may suffer from sleep apnea, be sure to have it checked by a medical specialist. And if you are diagnosed with OSA, don't forget that your dentist can offer a non-invasive treatment that works well for many people.